Hey team, it's Michelle. The unit recently had a patient who contracted both Akati and CLABSI while in our care. We reviewed the charting for the patient and it was found the CHG bathing was inconsistent or not charted properly. So we're going to do a little education on proper CHG bathing and charting. The presentation should take around 7 minutes and provide you with the information needed to utilize the best practice for preventing hospital-acquired catheter. So in conclusion, associated urinary
our goal is
tract
to prevent
hospital-acquired
and
central line
associated
bloodstream
bloodstream
infections.
CHG bathing is an
evidence-based practice for best care to help prevent these infections. Now you have the information needed
What
to
you
move
will
forward
learn
with proper CHG bathing and
And
charting.
you may know some of this
Thanks
already.
again, you guys,
But
so much
what is
for
a
all your
CHG
efforts
wipe?
and
Why do you use CHG?
care that you
What's
give to our
considered
patients. A central line or urinary catheter, how to properly give a CHG bath, how to document CHG bath in Meditech, and then some follow-up that we'll do. What is a CHG wipe? It's chlorhexidine gluconate, or CHG. It's a cleaning product used to prevent infection. So it comes in these packages on the unit. They are non-alcohol based and have aloe in them. And these packages are found in both supply rooms on the unit. Why we use CHG wipes. When patients are in the hospital, they are at higher risk of infection due to decreased immune system from illness, tubes, drains, and procedures being performed. So many bacteria, as you know, are resistant to antibiotic treatment, and the CHG actually binds to the bacterial surface and it disrupts the integrity of the cell membrane and leads to cell death. So these are really effective against gram-negative bacteria or E. coli or gram-positive bacteria or MRSA. At HCA, all units use CHG wipes for patients with central lines and urinary catheters, not just ICU. And these are given daily and charted daily. What's considered a central line and urinary catheter? So a VAS cath, either permanent or temporary. A port when it's accessed. A PICC or midline. We actually do a CHG wipe for patients with midlines, even though I think the true definition of a central line is not considered, a midline is not considered a true central line. An EJ or IJ. Chest tubes, Foley's, suprapubic catheters, G tubes or J tubes, and any drain, temporary or permanent. If you're not sure, ask your charge nurse, and if you can't find your charge nurse, give them a CHG bath. It's not going to hurt. So, how to give a CHG bath, and I apologize for this blurry picture. I could not get a better one. So, use only the CHG claws below the jawline. You're going to use one for neck, shoulders, and chest, one for arms, pits, and hands, one for the abdomen, groin, and perineum, one for the right leg and foot, one for the left leg and foot, and one for the back and buttocks. Make sure you let the patient know their skin's going to feel a little sticky for a few minutes. It will go away, but we can't wipe it off, and we need to let it air dry. Some side effects you may see are allergic reaction, a rash, which is usually mild, some skin dryness. So use only CHG compatible lotions or products when treating these symptoms. How to give a CHG bath continued. Wait 1 hour after soap and water bath. Again, the 6 wipes for each patient. Bariatric patients could require more, and that's fine. When cleaning a patient with a Foley or a tube after bathing the skin, clean 6 inches of the tube or Foley near the patient. Make sure that tube does get washed off as well. The CHG wipe is safe for the perineum and external mucosa, nothing inside. And occlusive dressing, CHG can be used for an occlusive dressing as well, right up to the dressing. You can slightly go over, but it will go right up to the dressing. Do not rinse and do not towel dry. Throw all your, throw all the wipes in the trash. Do not flush these. Documenting in Meditech. So after completing the bath, go to the process intervention tab on the right-hand side of the Meditech screen. Click that. Once you click that, go down to the routine care intervention and click on that. You will find hygiene at that point. You click open the hygiene section and it will say, was CHG bath given today? And you can click yes. You file and save and you do it daily. If patient's incontinent, bathing and charting should be done per incident. You can go back in and rechart that it was done again. Follow-up, what we're going to do for some follow-up with this. The whiteboard at the nurse's station will be updated daily with room numbers and then the reason for CHG. For instance, it'll say Foley or midline or bath cath, chest tube, whatever. The charge nurse will also perform chart checks and chart checks daily on CHG charting for those patients who should receive it. And then we also already receive monthly CAUTI and CLABSI's report, which we will share that information with you on the unit so you can see how great your work is doing. All right, in conclusion, our goal is to prevent hospital-acquired CAUTIs and CLABSIs. Patients already come in sick. We don't want to have anything extra happen to them while they're in our care. So CHG bathing is an evidence-based practice for best care to help prevent infections like these. You now have the information you need that's needed to move forward with proper CHG charting and bathing. And thanks again for all your care and efforts for our patients.